So good morning. Good morning as folks are joining us. Prediction that the New England Patriots will go to the Super Bowl. Now we recorded it. It's going to happen. We're so happy to have with us this morning to speak, who's often with us on 930 Caller, is Michelle Haimowitz, who's the Executive Director of the Massachusetts Head Start Association. And tomorrow we're also going to have Danielle Ewan, who's going to give a bigger federal update, and it just happened to be that they are coming back to back, which is great. And Michelle, before you get started, please tell us a little bit about you and how you came to be in your current role.
Hello, thank you. So yeah, like I said, I'm the Executive Director of the Massachusetts Head Start Association. We represent the 28 Head Start agencies here in Massachusetts. I've been here for 6 years. Previously with Jumpstart Government Relations Department, working with children and volunteers at Jumpstart, representing them at the state and federal level. And previously with that, I worked in the U.S. Senate and come from an early childhood advocacy and policy background, formerly of the campaign world as well, which is not nearly as fun as policy.
And who did you work for in the U.S. Senate?
I worked for the wonderful, can't be beat Bob Casey from Pennsylvania, who, if you have a chance to meet him, is really the kindest United States Senator you'll ever meet.
Great. Okay, and so we're excited to hear about the federal rule.
Share my screen. All right. Oh, starting with my God side. So I apologize. These are not the most beautiful or why is this not showing up? These are not the world's most interesting slides. But all right, can you see the full screen version now?
We are seeing it's a PDF, so yes.
What is happening, guys? Let me try again. We're only
this
4
is the hardest part of the
I found it.
Brian Dixon, while we're waiting, says, woohoo, Pennsylvania representing. And Tom Weber says, let's make sure Senator Casey cannot be beat.
I love the man. Also, any Philadelphia or Pittsburgh expats here, please identify yourselves. There's not that many of us. I'm from Philly. I went to college in Pittsburgh. Been in Boston for almost a decade now, but I love Pennsylvania. All right. So we're going to be talking a little bit about a final rule that was issued by the federal government, by the Office of Head Start, the Administration for Children and Families at HHS. But just a quick primer. I know we're all friends here, so I don't need to spend much time on it. But just for anyone who's not as aware, what is Head Start? Head Start is a federal program that was founded in 1965, actually as part of Lyndon B. Johnson's original War on Poverty. And it was this kind of first of its kind 2-generation approach, really specifically as an anti-poverty program, but really identifying early childhood as the place to lift families and children out of poverty. And so the real concept of it that has grown over the past nearly 60 years is to combine high quality early education with kind of the highest standards of care with comprehensive services for both children and families. The early education can be delivered in a variety of models and really core comprehensive services for both the child and the families, like health, mental health, nutrition, disability services, as well as comprehensive family services and support. And Head Start eligibility is determined federally for the most vulnerable families among us, including those with the lowest incomes, experiencing homelessness, children in foster care, and families receiving certain social services. So in Massachusetts, what this all comes down to is we have 28 federally granted Head Start agencies that serve over 10,000 children. Head Start is defined as early Head Start and Head Start for children to infant, toddler, and preschool. We also serve about 100 pregnant women through early Head Start. And Head Start serves, like I said, children experiencing homelessness, children in foster care. Many families receive also a child care subsidy to wrap around the Part Day Head Start Day that is federally offered. And a little bit about who our families are. Notably, our Head Start standards require quite high credentials for our staff and teachers. So over half of Head Start teachers, over 63%, have bachelor's degrees or higher. And Head Start works very closely with our parents to recruit parents into roles at Head Start, over a quarter of all Head Start staff are current or former Head Start parents. Incredibly
And
quick
so, Michelle,
overview
just for
of who we are.
logistics wise, so the federal government funds each of the 28 Head Start agencies, and along with that funding comes a whole different set of standards. And so
right.
every time, and when we think about Head Start as part of the mixed delivery system, we know in some other states it has been a little trickier to have a clear, seamless system, including Head Start. We also know that Head Start standards often lead the way as far as teacher credentials, those kinds of things. So, and Michelle's going to talk about the reason why Head Start has a final rule is because it is primarily funded by the federal government, from the government to the programs.
Yeah, so that's right. So Head Start is a very unique early childhood model that is federally determined. So most of our early childhood regulations in the state or across the country are driven by the states. There is the large Child Care Development Block Grant, which is a big federal funding program that comes from the federal government that's granted individually to each state. And then the state determines a number of policies and funding models and choices that then get delivered to the early childhood programs that serve subsidies and federally funded slots through the Child Care Development Block Grant. Head Start is a completely different way of funding and regulating childcare and early education, where it's directly granted from the federal government to each individual agency. It doesn't pass through the state, it doesn't pass through any other funder. And each agency is then responsible to the federal government for following the regulations and requirements, which tend to be at a higher level than Child Care Development Grant regulations. So for example, our staff credential requirements require degrees. That's why over 63% of Head Start teachers have bachelor's degrees, and a number of other regulations kind of sit higher than other childcare regulations in terms of early childhood quality, in terms of kind of physical spaces, in terms of everything that oversees the childcare program. The regulations look a little bit different, and we're responsible to the federal government. In Massachusetts, center-based Head Start programs, for the most part, are required to be licensed as well by the state. That's not required in every state. For Massachusetts, they are. So our programs are also EEC licensed. So our programs are also responsible to EEC for all licensing requirements and have to abide by those as well. And that can sometimes land us in some difficult alignment issues, which we work closely with EEC on. So this regulation, like Amy said, came about from the federal government. Head Start is, in addition to all of our licensing requirements of the state, is federally governed and federally monitored. And there's two big core pieces of federal law, essentially, that we are governed by. The first is the piece of law. It's called the Head Start Act. This is an act of Congress. Congress must pass this law, and the president must sign it. It was last signed by the president in 2007. This is the law that all of our regulations must abide by. It has been due for reauthorization, as you can see, for a number of years, though we don't see reauthorization coming anytime soon. Then the law gets taken and interpreted by the federal agency called the Office of Head Start, which sits at the Administration for Children and Families at the U.S. Department of Health and Human Services. The ACF is the same office that has the Office of Child Care, which oversees the Child Care Development Fund. And the Office of Head Start interprets the Head Start Act and turns it into Head Start Program Performance Standards, which is our regulatory document similar to, licensing standards, for example, at EEC. This was previously updated in 2016. And this updated regulation is an entire overhaul of everything within our performance standards. And it really is an entire overhaul of everything within our performance standards. It is a 313-page preamble, for example. So I'm not going to go over 313 pages today, but I'll go over some highlights. So these were proposed last November. There was a comment period, which they received over 1,300 comments on. And then a few weeks ago, the Office of Head Start released the final regulations, which updated everything below that we'll go into a little bit. Any other grounding questions before I can jump into some of the big pieces? I'll make sure I have some time at the end to get into why all this matters for those of you who are not Head Start grantees. So if I fly through some of these things, Within it, I apologize. I want to get to the end of why you should care about this if you're not a Head Start grantee. The thing that is getting the most press is the wage requirements within the rule. Head Start has never had wage requirements per se like this before. Obviously, Head Start educators and staff have to be fairly compensated, and programs have been very concerned with competitive wages for their staff to retain and attract educators. But this is the first federally required wage standards that Head Start has had. And the requirements are, as you can see, quite difficult to meet. They won't be effective for 7 years. But in 7 years, Head Start teachers must be paid comparably to the annual salary of preschool teachers in their local school district, adjusted for responsibilities, qualifications, experience, and hours. That means that the preschool teacher, or if that local school district doesn't have preschool, it must be set to 90% of a kindergarten teacher's salary. They must match, assuming their other qualifications and responsibilities match. What that also means is if your Head Start teacher has the same responsibilities, qualifications, and experience as a public school preschool teacher, which many of our teachers do, but that public school preschool teacher works 10 months a year and the Head Start teacher works 12 months a year, then that Head Start teacher actually needs to make more, is what these regulations say. We also need to make sure that not just our teachers, but all of our staff have a strong salary floor, and that all of our staff must be paid at a wage that's sufficient to cover the cost of basic needs in their local setting. And they give several examples of tools to use that. But as we know, in places like Boston and other places in Massachusetts, that is also quite a high standard to meet for all of our staff. And then the wage requirements also guarantee that no matter what age children the staff work with, they must be paid comparably. There is an exemption to the wage statute for very small programs that serve under 200 children. And like I said, this is effective in 7 years. Similarly, this new rule includes some new benefits and staff wellness components that take effect in 4 years to receive or have access to high quality affordable health coverage, behavioral health services as well, making sure that our staff have access to resources on things like childcare for their children, public service loan forgiveness, and other resources that our staff should have access to. Similar exemption for small programs. And then in a shorter amount of time, programs must make sure they have a strong break policy to provide staff with regular breaks. And some requirements around around supervision during such breaks. Those are the pieces that are getting the most press and that are clearly some of the more difficult and expensive components to meet. I'm going to go into a few other things that are getting less press, but also very important, that are in the final rule. I'll look at the time and know that of what I'm saying, there is 300 pages more of regulations. So happy to answer any questions or to talk offline around other components of the final rule. The other really big piece of the final rule is around mental health. And there's quite a few regulations here, but really ensuring that programs are promoting a culture of mental health in their program, both for adults and children, and really importantly for staff. And so there's requirements on staff mental health, requirements for family and caregiver mental health, as well as for children. Head Start has always had a requirement to secure mental health consultation for educators in their programs. The new regulation includes a time component that those mental health consultations must be at least monthly within each program. And there are some regulations around who can be that mental health consultation and what happens if they can't access a licensed mental health clinician every month. But that monthly service has been added. There are some other regulations as well around the way that programs engage in family engagement and access and use strong community data around modern, accessible communication methods, the ways in which programs need to communicate with families in 2024. Has some new requirements around ratios for Head Start family service workers, because every Head Start child, in the same way that they have a teacher or home visitor, also has a family service worker to work with that family on family resources. some ratio requirements there. Head Start programs are required to conduct very, very comprehensive community assessments every 5 years, and there are some long and strong new regulations around what those community assessments look like and what data programs are required to access about families, both that they serve and families that they don't serve, so they better understand their community and who they can connect with. And finally, there are some really welcome changes on Head Start eligibility. Like I said, Head Start eligibility is federally determined. Primarily, Head Start families are eligible at under 100% of the federal poverty level. And in such a high cost, that's about $30,000, for example, for a family of 4 right now. And in such a high cost of living state in Massachusetts, that has never quite met our need of what a low-income family in Massachusetts looks like. And so we have been doing advocacy for many, many years on Head Start eligibility, but like I said, it is determined by an act of Congress, which hasn't happened since 2007. And so some welcome changes to eligibility to help families access Head Start who need it. They exclude certain sources of income from a family's gross income calculation so they can be eligible. Things like Social Security benefits, veterans benefits, alimony, child support are excluded from the family's income to make sure that really just their true gross income is counted towards that federal poverty level. It includes some adjustments for families that spend excessive costs on housing. More than 30% of their income on housing can be deducted from their gross income as well, to make sure that families who have less disposable income because they are paying for it in housing in a high cost of living state can access. Some changes allowing programs to prioritize the enrollment of children of staff members in their selection criteria. It is a nuanced and complicated way that Head Start selection criteria happen. So happy to talk more about that offline with anyone, but allowing for some space for children of staff. Head Start has always had a requirement that 10% of their enrollment be at least 10% be children with disabilities, and some clarification on what that means for their actual enrollment. And it also requires programs to assess clearly barriers to access, including transportation, and encouraging programs to facilitate transportation for children who need to, which we know is a challenging and expensive thing to do. All that sounds pretty great. Much of it sounds pretty great. We want to pay our teachers more. We want to pay our staff more. We want to provide them with high quality benefits. We want to facilitate high quality mental health for our children, and transport all the children we can. The catch here is that there's not a cent included in the rule. The Office of Head Start cannot authorize funding. Only Congress can do that, in the same way that EEC can't authorize funding. Only the legislature can do that. Congress needs to pay for this, and Office of Head Start can't pay for it. And so all of these things that need new money in the rule, the wages, the benefits, the increased staff now if we need to cover more breaks and reduce ratios and have monthly mental health consultants, all the transportation costs, all of these new technologies they want us to use, all the other regulations that I didn't go into, regular lead testing. These are things that cost money, and the rule doesn't include a cent to do that, and we need Congress to do that. You're not a Head Start grantee. What's the bottom line for you? And this is the part I really wanted to talk a little bit about. Head Start, like Amy said, is a key component of our mixed delivery system. Head Start programs are in your communities. Head Start programs are serving the same families as the rest of our programs. Head Start families are going into public schools in the same way that other early childhood programs are feeding into public schools. Head Start programs are subsidy providers. 30% of actual Head Start children receive childcare subsidies to wrap around the Head Start day. And notably, our staff is your staff. We all pull from the same pool of teachers, of educators, of staff. Our wages are going to start rising. They already have. In most communities, programs need to raise wages, as the rest of the field knows, to be able to recruit and retain our staff, as we've all been working to do to raise wages. But ours are going to start rising pretty rapidly and pretty extremely. We know what the gap is between our teachers and public school preschool teachers, and it's pretty significant in most communities. And our wages are going to need to keep up with public school teachers. So every new contract negotiation that a public school union has, we need to then match it after 7 years. And so we are going to be putting a strain on the system and the way that we pay our educators and putting some competitive barriers on the field in terms of wages because we need to comply with this rule. And so we're going to be putting that strain on the workforce for teachers, but also for all early childhood staff, and then for some key staff that we all use, like mental health consultants and behavioral health staff and resources that our field needs. We are going to need to be hiring more of these people. We're going to need to raising wages to comply with these federal staff. And then that's if it's funded and we're able to do that for everyone. If Congress doesn't fund it and we still need to comply with the rule, or Congress funds it a little bit and we still need to comply with the rule, the way the Head Start programs are going to have to do that is to reduce the number of children that they serve so that they can meet these wage requirements. You know, same pot of money, new rules. We would need fewer children served to do that, which would put a huge strain on access in Massachusetts, which we really don't want to see. So this is going to ripple through the field quickly. I know we have 7 years to get to these wage requirements, but we're going to need to make some steady progress over the next 7 years. And we're going to be putting a strain on the field that we don't want to see. So how do we reduce that strain? There's really 3 big things that are coming out. The first is advocacy, significant advocacy that we're all going to need to do together. Obviously, in Congress, we need to increase federal Head Start funds so that Head Start programs can comply with this rule. We have no choice. We need to comply with it. We do not want to reduce significantly the number of children we serve in our communities. We do not want to put that strain on access. We don't want to do that to vulnerable families. We need these federal Head Start funds to comply with the rule. We also need other federal funds. We need to increase community development block grant funds, CCDBG funds, which fund our subsidy system and our access and our rate in Massachusetts so that our whole field can rise along with Head Start so that all of our wages can rise together and that we are not significantly increasing the pay gap between childcare and Head Start here in Massachusetts. We need both of these funding methods to move together, and Congress can do that. And then here in Massachusetts, we have a number of resources. We are so lucky to be in Massachusetts compared to so many of my colleagues that are working on this implementation across the country. We have all of these pots of funds. We have Head Start state supplemental grants. We have our rates. We have C3, which all play an enormous role in our wages, in our program success, in the implementation of this rule, and for all of our childcare field. That we need to keep seeing all of those pots grow to keep up with our wages. And we need to continue to put a big stake in the ground on access to make sure that all of these rising wages and all these incredible changes in quality and in program services are not coming at a barrier to access. And then programs are going to, funding or not, be working towards implementation. Everything I shared and 1,000 more things in programs are changing, and they're going to be working towards implementation. They're going to need partners in their communities. If you're a mental health provider, behavioral health services, if you want to play a role in seeing some of these things through, make sure you are working with your Head Start programs. And at the Massachusetts Head Start Association, we're going to be working closely on alignment. Like I shared, we must comply with both these regulations as well as EEC regulations. And we'll be working closely with our state partners on making sure that these align well between Head Start and EEC. Whew, that was quick. And that's all I've got. You will have these slides. I sent them to Amy and Marissa, and so you have my contact information as well. Did I do it? What time is it? Oh, 9:50.
You did it, Michelle. That was incredible. I'm glad we recorded. So if you're watching the recording, hello. We had over 90 people tune in this morning, still have 84. So I think this is something that people wanted to hear about. The first couple questions were about if there was going to be additional money for additional services, which you kind of answered that spot on. And the slides are already posted. So I put the link in the chat for our follow-up, follow-up folder. There was, so Kathy and Rachel asked that question. There has already been support for programs to reduce their numbers of children served, which has supported growth in salaries. Donna Danette says, interesting to see a ratio assigned for family partnership staff. I'm hoping our sector can continue that examination of what ratio of director admins to teachers, family slots supports both high quality and reduces admin burnout. The housing cost eligibility will really help eligibility in Mass as cost of living, household, et cetera, is so much greater than other regions of the country. And somebody Oh, somebody wants your contact information in chat, so
Throwing it in
maybe
here.
add your email, and I think
Oh, thank you.
that, so I think, and that, with 28 grantees, there is an opportunity for folks, if you don't have a relationship with the Head Start near your community, to make one and to just really appreciate kind of what the context that Head Start is working in, and the changes that they're looking to make. And I know that Head Start does, it influences what states do. I think in Massachusetts, as Michelle said, we have a set of resources and even structure that most states don't have. And so I think we have such an opportunity here to kind of better connect, align, think about this mixed delivery system. Michelle, can you just say one word about the half day versus full day in Head Start? Because I think sometimes that can be confusing for folks.
Yeah. So early Head Start, birth through 3, infants, toddlers, is a full year program at 4 or 6 hours a day. Head Start, federally funded, purely federally funded, is a school year program at either 4 or 6 hours a day, depending on the grant. That is the most that the federal government will pay for a preschooler, and a 4 or 6 hour day, the most for an infant toddler. And so if a family is working and is duly eligible for both Head Start and a subsidy, for example, and they need more than a 4 or 6 hour day for 10 months a year, they need to also have a childcare subsidy to wrap around that 4 or 6 hour day to pay for the full day services. The federal government will not pay for a full day. That is what our federal regulations say.
So that is like a whole nother level of braiding and blending, as they say, funding streams. Michelle, thank you so much for sending Marissa adds. And to that point, this is going to be a great opportunity for wage advocacy for the entire EEC system.
Yes,
and
we want to
Donna
make sure
said,
that we're doing it together.
Yes.
Because we want to make sure that we are all pulling from the same pot of teachers. Our teachers are your teachers. Our teachers used to be your teachers. They'll be your teachers again. Our field is always moving between program types. And we want to make sure we're all, while rising tide lifts all boats. So we need to be jointly advocating for Head Start funds, for CCDBG funds. We need to be at the state jointly advocating for C3 and rates and Head Start state supplemental and access. We need to be working together to make sure that we're not fighting against each other in the end.
Donna also shared, I love that perspective. What impacts part of the mixed delivery system impacts us all. So we will leave it there. Again, tomorrow we'll hear from Danielle Ewan, who will talk about other parts that are happening at the federal level. And we'll also have opportunities to ask questions there. If you think of a question, you can always send it to me. We've also booked the commissioner for September, October, November, December. Amy Kershaw will join us. We have those dates on the calendar, so stay tuned. We will see you all tomorrow morning. Thanks so much, Michelle.
Thanks, Amy. Thanks, everybody.